Hi everyone, I am Amitha, first year MSW student of RGNAYD Sri Perumbatur. Today I am going to talk about what is personality test related to the seminar given by Dr. Rambabu Bocha on the paper Psychology for Social Workers. So before coming to my topic, I would like to say what is psychological test. Psychological test is a standardized measure of a sample of a person's behavior that is used to measure the individual difference among that exists among the people. So there are various types of psychological tests, which are attitude test, aptitude test, neuropsychological test, personality test, etc. So when it comes to personality test, before knowing what is personality test, it is important that we need to know what is human personality. Personality is something that we informally assess and describe every day. When we talk about ourselves and others, we frequently refer to different characteristics of an individual's personality. Psychologists do much the same but in a more systematic and scientific way. When it comes to personality test, it is a tool used to assess human personality. Personality testing and assessment refer to techniques designed to measure the characteristics, patterns of traits that people exhibit across various situations. There are several personality tests, and as a part of conducting a personality test, I used EPQR, which is Eysenck Personality Questionnaire revised for conducting the study on my client. The EPQR is a self-assessment personality test for administration to normal population. This test measures three primary Eysenckian traits of extroversion or introversion, neuroticism, psychoticism, and along with lie score. The EPQR contains 100 items to measure the three personality dimensions of extroversion, neuroticism, psychoticism, as well as the lie score. A dichotomous response format is used with respondent ticking yes or no. When it comes to the three traits and the lie score, extroversion or introversion means extroversion are oriented towards the outside world, prefer to the company of other people, and tend to be sociable, impulsive, adventurous, assertive, and dominant. And introversion means the exact opposite of the extroversion characteristics. And when it comes to the neuroticism, it is the emotional stability, which means neuroticism are characterized as anxious, depressed, tense, irrational, and moody. A person who are having the neuroticism traits, they may have low self-esteem and prone to guilt feelings and feel dissatisfied. Psychoticism, when it comes to the psychotic people are aggressive, antisocial, tough-minded, cold and egocentric. And when it comes to the trait of lie score, if the lie score is above 7, the data is not reliable, which means data need not be rejected. If lie score is 7 and below, we can assume the score of the subject is consistent. We can consider this score as valid in both clinical and academic field. So my client is a 16-year-old female. She is the oldest one in her family and comes from a urban background. She has knowledge of only one language, which is Tamil. And also my client is an inmate of the observation home. So I took the test on her. For taking the personality test, which is EPQR, I seat the participant comfortably and build a good rapport with her. Then the Eysenck Personality Questionnaire revised is given to the participant along with the writing material. So my client is only know Tamil. I explained every questions which made her understand easily what are the questions are. Some questions among the 100 questions of the EPQR scale is: do you stop think things over before doing anything? Does your mood often go up and down? Do you take much notice of what people think? Are you a talkative person? Would being in debt worry you? Etc. After taking the test of the client, I got the score which is calculated by using the manual of EPQR. There is two types of score, row score and sten score. First I got the row score, then later it converted to the sten score using the manual. So related to the test, I got the result as the client have psychotism, which the row score is 12, sten score is 10, and in neurotism the row score is 13 and the sten score is 5. When it comes to the extroversion trait, the row score is 15 and sten score is 6, and in LISCO the row score is 8 and the sten score is 6. The scoring is considered as if the sten score is 1 to 4 indicates below average, and 5 to 6 indicates average, and 7 to 10 indicates above average. So my client got sten scores 10, 5, 6 and 6 respectively. The interpretation of psychotism is above average strength, and neurotism extroversion and lie score average strength. The subject has above average score in psychotism because the sten score is 10. The subject shows angry, lack of empathy and tend to be cruel, aggressive and troublesome. Sometimes subject shows insensitive, antisocial, violent behavior. The subject has average strength in extroversion, neurotism because the sten score is 5 and 6 respectively. Neurotism shows that the participant experience average level of stress and anxiety. Sometimes they worry about relatively significant matters and feeling unable to cope with the life stresses. Average strength in extroversion shows that the subject tend to be talkative, outgoing and lively and impulsive. The subject shows average strength in lie score. It indicates that the subject tries to make good as herself, which means she wants to change her behaviors. So for after analyzing the all scores, the results, the client results of the client, the main interventions I would like to suggest is the meditation for anger management, and there is a psychologist in the observation. So the client has to be cooperative with the psychologist for the betterment of her mental behaviors and characteristics. So that all are the interventions I would like to provide, and that all related to the personality test which I used, which is EPQR. Thank you.